Welcome back to SurgiSmart Cut to the Core. The podcast, well, it's more like a deep dive, really, where we take these surgical topics
Yeah.
and, break them down so you can understand all these surgical conditions out there. I'm Major Munish Chauhan, and I'm a General Surgery Registrar in the British Army and at Oxford Deanery. I'm also a Senior Research Fellow at the Center for Army Leadership. Feel free to connect with me on LinkedIn if you have any questions or, just find this stuff interesting.
Sounds like you've got quite a bit going on.
Oh, it keeps me busy. But that's what we surgeons love, right?
I suppose so. Always on the go. Speaking of always on the go, did you know that there's this condition, super common, that tons of people, especially those over 60, might have and not even realize it?
You're talking about those hiatal hernias, right?
IMGO. Over half of adults over 60 walking around, potentially with a hiatal hernia and totally oblivious. Wild, huh?
It really is. And that's exactly what we're diving deep into today. Hiatal hernias. We've got some great source material here, ready to break it all down.
Sounds like a plan. Where do we even begin with something so, I don't know, stealthy?
Well, I guess the first thing is, what exactly is a hiatal hernia?
Yeah.
For those who are hearing about this for the first time.
Okay, so picture this. Your diaphragm, that big muscle that kind of separates your chest from your belly.
Right. Got it. The diaphragm.
It's got this little opening, right, called the hiatus. That's where your esophagus, that food tube, travels through from your mouth down to your stomach. Makes sense.
It makes perfect sense.
Now, a hiatal hernia happens when, well, part of your stomach decides it wants a change of scenery.
It gets a little adventurous.
Exactly. It pokes up through that hiatus opening and into your chest cavity. Like, hey, I want to be up here now.
Sneaky stomach. But wait, I've heard there's more than one type of hiatal hernia, right? Like different variations on this whole stomach traveling theme.
You're sharp. You've got sliding hiatal hernias, which is the most common type. The gastroesophageal junction, where the esophagus meets the stomach, that slides up along with part of the stomach.
Like, I don't know, slipping out of place.
Yeah.
And this is the one often linked to GERD, right?
Exactly. Gastroesophageal reflux disease, GERD, all that heartburn and regurgitation, not fun.
And then there's the other kind, the paraesophageal.
Paraesophageal hiatal hernia. Less common, thankfully, but potentially a bit more, well, worrisome.
Worrisome how?
Well, in this type, instead of the junction moving, part of the stomach bulges up next to the esophagus. Think of it like a balloon trying to squeeze through a too small hole.
Okay, I get the picture. So why is this one more worrisome?
Because while it might not always cause those classic GERD symptoms, there's a risk of things getting, well, twisted.
Twisted, like literally.
Yeah, its stomach could twist or even lose its blood supply. That's a serious situation.
Sounds like a ticking time bomb. So how on earth do we even know if we have one of these hernias lurking inside us? Especially if they could be so silent.
That's the tricky part. It's a bit of detective work, really. Doctors use a few different methods to get to the bottom of things.
Like what? Give me the inside scoop.
Well, there's endoscopy. That's where they use a thin, flexible tube with a camera on it to actually see inside the esophagus and stomach.
So they can, spot the hernia right there.
Sometimes. It depends. They can definitely see if there's any damage from reflux or other issues.
Makes sense. What else do they use?
Another one is a barium swallow. You basically drink the solution that shows up really well on x-rays, and then they can track how it moves through your digestive tract.
So they can see if the stomach's, in the wrong place.
Exactly. And then there's the CT scan. That gives them detailed images, kind of like x-ray slices of your chest and abdomen.
So they can get a really clear picture of what's going on in there.
Yep. Which test they use depends on, what type of hernia they suspect, what symptoms you're having, that kind of thing.
Okay, so let's say you do get diagnosed with a hiatal hernia.
Yeah.
What happens then? Is it an automatic trip to the operating room?
Not necessarily. It really depends. They take into account, the type of hernia, how bad your symptoms are, if there are any complications.
So it's not always a straight shot to surgery. That's good to hear.
For a lot of people, especially those with small sliding hernias and mild symptoms, they can manage it with lifestyle changes and medication, really.
That's a relief.
Yeah.
So it's not always doom and gloom?
Not at all.
Yeah.
There are lots of options.
So tell me more about these lifestyle changes. What kind of things are we talking about?
Well, things like losing weight if you need to, eating smaller meals more often, avoiding foods that trigger your symptoms, spicy stuff, fatty foods.
Oh, so those are out. Bummer.
Well, maybe not forever. But it's about making smart choices that support your digestive health. Quitting smoking, too, if you smoke.
Right. Makes sense.
Yeah.
And what about medication? What role does that play in all of this?
Medication, especially these things called proton pump inhibitors or PPIs, they're
Mhm.
often the first line of defense. They help control how much acid your stomach makes.
So they, like, reduce the acid and give your esophagus a chance to heal.
Exactly. It's like turning down the volume on the fire in your stomach.
That's a good analogy. But what about those more serious complications we talked about? The twisting and the potential blood supply issues. When does it go beyond lifestyle changes and medication? When do you actually need surgery?
That's a really good question. And it's when things get, well, more urgent.
Urgent how?
Like if the conservative stuff isn't working or if there are complications like strangulation or bleeding, then you can't really wait. Surgery becomes crucial.
It's a reminder that these hernias, while they might seem manageable at first, they can take a turn for the worse.
Unfortunately, yes. But the good news is we have surgical options,
Yeah.
and they've come a long way.
Oh, yeah. Tell me more about these surgical options. What kind of procedures are we talking about?
Well, the two main ones are Nissen fundoplication and hiatal hernia repair. They both have their own, approaches.
So break it down for me. What's the Nissen fundoplication all about?
Okay, so imagine the surgeon takes the upper part of your stomach and wraps it around the lower part of your esophagus, like creating this reinforced valve to prevent reflux.
So they're basically tightening things up to stop the acid from splashing back out.
You got it. Think of it like tightening a loose faucet to stop the drips.
Okay, I like that. And what about the hiatal hernia repair? What do they do in that one?
In that one, they focus on, well, reducing the size of the hernia and tightening that diaphragm opening to prevent the stomach from pushing back up, like tucking in a stray shirt and tightening your belt to keep it from popping out again.
I could definitely visualize that.
Right.
So both procedures aim to, well, reinforce and reposition things to restore normal function.
Exactly. And these days, both of these procedures, they often do them laparoscopically.
Laparoscopically, you mean like minimally invasive surgery?
Exactly. Tiny incisions, miniature instruments, a camera to guide them, less pain, faster recovery, smaller scars. It's pretty amazing.
Wow, that is amazing. It's like science fiction come to life in the operating room.
Pretty much. Technology has come a long way. So yeah, that's the surgical side of things.
It's incredible how far surgical techniques have advanced, making the whole experience less daunting for patients. So just to recap what we've covered so far, hiatal hernias are surprisingly common, especially in the over 60 crowd. They can be tricky, often hiding out without any noticeable symptoms. We've got the two main types, sliding and paraesophageal, each with its own quirks and risks. And we've talked about the tools doctors use to find them and the range of treatment options available, from lifestyle changes and meds to surgical interventions. It's a lot to take in, but hopefully it's all making sense.
Hopefully. We've covered a lot of ground, that's for sure. But it's all important stuff to know.
Absolutely, and there's even more to explore. But for now, I think it's a good place to take a breather.
A breather sounds good. We've definitely earned it. Whew. It's been quite a journey so far. All this talk about sneaky stomachs and sliding junctions.
I know, right? It's amazing how much we've uncovered already. But one thing I'm still curious about is what actually causes these hernias to develop in the first place?
That's a great question. It's not always crystal clear, but there are a few things that can make you more prone to getting a hiatal hernia. Age is a big one. As we get older, well, things start to wear and tear, right? And that includes our diaphragm muscle. It weakens over time, and that makes that hiatus opening, the one we talked about, more likely to, well, give way.
So it's like a gradual loosening over time, making it easier for the stomach to slip through. Makes sense.
Yeah.
But is it just age? Or are there other lifestyle factors that can contribute to this weakening?
Oh, absolutely. Obesity is a big one. Carrying around extra weight, it puts a lot of pressure on your abdomen, and all that pressure pushes against the diaphragm, increasing the chances of a hernia.
So maintaining a healthy weight isn't just about fitting into your genes, it's about protecting your insides from undue stress. Makes sense. What about pregnancy? I mean, that's a temporary increase in abdominal pressure, right? Can that also play a role?
You're right on the money. Pregnancy, with the uterus expanding and all, it can definitely contribute to hiatal hernias, especially the sliding type. It's like a temporary housing situation for the stomach, if you will. But it usually goes back to normal after delivery.
So anything that significantly increases that abdominal pressure, even for a short time, could potentially push the stomach in the wrong direction.
Exactly. Even chronic constipation, where you're straining all the time, that can contribute too. It's all about those pressure dynamics in the abdomen and how they affect that delicate diaphragm opening.
It's fascinating how seemingly unrelated habits can have such a knock-on effect on our internal structures. It's all connected, isn't it?
It really is. Speaking of connections, remember how we talked about sliding hiatal hernias being linked to GERD?
Yeah, I'm still a bit fuzzy on how a hernia actually causes acid reflux. Can we unpack that a
What?
bit more?
It all comes down to that lower esophageal sphincter, the LES. Remember, that's the muscular valve between the esophagus and stomach.
Vaguely. Refresh my memory.
It's like a one-way door. It should only swing open one way, letting food down into the stomach, but preventing anything from coming back up.
Right, right. The gatekeeper of the stomach. So how does a hiatal hernia mess with that?
Well, when that gastroesophageal junction slides up in a sliding hernia, it disrupts the LES. The valve gets weakened and can't close properly, and then, well, stomach acid sneaks back up into the esophagus.
So it's like the door's left ajar, letting those unwanted acidic visitors back in.
Yeah.
And I guess the severity of the symptoms depends on how big the hernia is and how much the LES is affected.
Exactly. Small hernia, maybe occasional heartburn. Larger hernia, more frequent and intense reflux. It's all about degrees.
Okay, that makes sense. And you mentioned earlier that PPIs are commonly used to manage hiatal hernias and GERD. How effective are they really? And are there any downsides to using them long term?
PPIs are generally very effective at reducing acid production. They're usually the first thing doctors try for GERD, whether there's a hernia involved or not. But like any medication, long-term use can come with some potential risks.
There's always a catch, isn't there? What kind of risks are we talking about?
Well, some studies have suggested that prolonged PPI use might be linked to an increased risk of infections, nutrient deficiencies, even bone fractures.
Oh, wow. That sounds pretty serious. Should people be worried about taking PPIs?
It's important to keep things in perspective. The risks seem to be relatively small. And for many people, the benefits of PPIs outweigh the potential downsides. But it's always a good idea to talk to your doctor about the pros and cons, especially if you're thinking about long-term use.
It's all about that individual assessment, weighing the risks and benefits for each person. Makes sense. So let's shift gears back to surgery for a bit. We talked about Nesson fund application and hiatal hernia repair as the two main surgical approaches. And laparoscopic surgery seems to be the gold standard these days. But are there ever situations where open surgery is still necessary?
You're right, laparoscopic surgery has been a game changer. But there are some cases where open surgery might be the better option.
Like when?
Well, if the hernia is very large or complex, for example, or if the patient has other health issues that make laparoscopic surgery too risky, it really comes down to the surgeon's judgment and what's best for the individual patient.
So it's not a one-size-fits-all approach. Every case is unique. Okay, so let's talk about what happens after surgery. What's the recovery like for hiatal hernia surgery, whether it's laparoscopic or open?
Recovery is different for everyone, of course, but in general, laparoscopic surgery is much faster. Patients can often go home the same day or the next, back to normal activities within a week or two. Open surgery, well, that usually means a few days in the hospital, and a longer recovery, maybe 4 to 6 weeks.
Wow, that's a big difference. It really highlights how far surgical techniques have come. Less pain, less downtime. Are there any specific things people need to do or avoid after surgery to help things along?
Definitely. Right after surgery, you'll be on a liquid or soft food diet for a while. To give your digestive system a chance to, ease back into things, you'll gradually transition back to a normal diet, but it's important to follow your doctor's instructions. Spicy foods, acidic foods, anything that could irritate the stomach, that's a no-no for a while.
So no hot curries or orange juice just yet. Got it. What about exercise? When can people start moving around again after surgery?
Your doctor will tell you what's best for your specific case, but usually you want to avoid anything strenuous for at least a few weeks. Gentle walking is good to get the blood flowing and prevent clots, but it's a gradual return to normal activity. Listen to your body, don't overdo it.
Patience is key, as with most things in life. Now, one question I often hear is whether you have to restrict your diet forever after hiatal hernia surgery. Is it a life sentence of bland and boring food?
Don't worry, you can still enjoy your food. For most people, long-term dietary restrictions aren't necessary. Once you're fully healed, you can usually eat pretty much whatever you like without having to worry about triggering symptoms.
That's good to know. It means you can still enjoy those curries and orange juice eventually. Though maybe in moderation, right?
Exactly. It's always smart to pay attention to how your body reacts to different foods. Just because you can eat something doesn't always mean you should.
It's all about finding that balance, enjoying life's pleasures, while being mindful of your own individual needs. So before we move on from recovery, let's talk about follow-up appointments. Why are they so important after surgery?
Follow-up appointments are crucial. They let your doctor monitor your healing, make sure there aren't any complications, and check that the hernia isn't making a comeback.
So it's like a safety net, making sure everything's going smoothly.
Exactly. Think of it as teamwork, you and your doctor working together to ensure a successful recovery. It's an ongoing process.
We've certainly covered a lot of ground in this deep dive, haven't we? From the causes and types of hiatal hernias to the diagnosis and treatment, and now the recovery process. It's amazing how much there is to know about this seemingly simple condition.
It's true. There's always more to learn. But even with all the complexities, there's a lot of hope and empowerment that comes with knowledge and understanding.
Wow. We've really gone deep on this one, haven't we? From the anatomy of it all to the causes, symptoms, diagnosis, even delved into treatment. It's amazing how much there is to know about hiatal hernias. It's a condition that, well, a lot of people just don't think about until it affects them, you know?
It's true, it's often overlooked. But, like we've been saying, it's incredibly common. And understanding it, even the basics, can make a big difference.
Absolutely. So before we wrap up this deep dive, maybe it'd be helpful to recap some of the key things we've talked about, just to make sure it all sinks in for our listeners.
Sounds good to me. Let's crystallize all this info, make it easy to remember.
Okay, so first and foremost, hiatal hernias, they're way more common than people think.
Yeah.
Way more. Remember that stat. Over half of adults over 60 could be walking around with one and not even realize it.
It's mind-boggling, really. And that's why it's so important to know the risk factors so we can be, proactive about our health.
Exactly. We talked about age being a big one. The diaphragm naturally weakens over time. But then there are those lifestyle factors too, right? Obesity, chronic constipation, things we can actually do something about.
It's all about making those healthy choices, taking care of ourselves, and understanding that, what we do on the outside can impact what's happening on the inside.
It's all connected. And then, of course, we've got the two main types of hiatal hernias, the sliding hernia, which is often tied to GERD, and the paraesophageal hernia, which, well, it might be less common, but it can be more serious, more complicated.
Knowing the difference between those two, that's crucial because it guides everything else. The diagnosis, the treatment, it all flows from there.
And speaking of diagnosis, we talk about all the different tools doctors use to figure out what's going on. Endoscopy, barium swallow, CT scans. It's like a detective story, putting all the pieces together.
It is, and it shows how advanced medical technology has become and how dedicated those healthcare professionals are to finding the right answers. It's quite impressive.
It is. And then when it comes to treatment, well, we saw that it really depends on the individual, right? Some people, they can manage their symptoms with lifestyle changes and medication. But for others, surgery is necessary, especially if there are complications.
The good news is there are lots of effective treatment options available, from things we can do ourselves, like making those lifestyle adjustments, to minimally invasive surgical techniques that are much easier on the patient.
It's all about finding what works best for you, working with your doctor to come up with the best plan. But it's empowering to know that hiatal hernias, even the complicated ones, can be managed.
Absolutely. And I think one of the biggest takeaways from all of this is the importance of prevention.
You're talking about those lifestyle changes we keep coming back to, right?
Yep. Maintaining a healthy weight, eating a balanced diet, managing stress, dealing with constipation. All of those things can reduce your risk of developing a hiatal hernia in the first place. And even if you already have one, those healthy habits can help you manage your symptoms and prevent things from getting worse.
It's like we have the power to take control of our health.
Yeah, we do. And it's never too late to start. Think of it as an investment in your future well-being. A really good one, actually.
It's definitely worth it. So as we wrap up this deep dive into hiatal hernias, what's the one thing you want our listeners to take away from all of this?
Knowledge is power. The more you know about your body and how it works, the more empowered you are to make good decisions about your health. Don't be afraid to ask questions, to do your own research, to be an active participant in your own healthcare. You have more control than you think.
It's about moving from a place of, fear and uncertainty to a place of, like you said, empowerment, being proactive. It's a mindset shift, really.
It is. And it can make a world of difference.
Well, on that note, I think we've reached the end of our journey into the fascinating world of hiatal hernias. Hopefully, our listeners have learned something new today and maybe even feel a little bit more empowered to take charge of their health.
It's been a pleasure, as always. Thanks for having me.
Thanks for sharing your expertise with us. And to our listeners, thank you for joining us on SurgiSmart Cut to the Core. Until next time, stay curious, stay informed, and stay healthy.